Good afternoon. As promised, we're coming to you live from the Safari Park Hotel. This is the inaugural Africa Social Behavior Change Conference. It has been taking place for the last 3 days, started on Tuesday. A number of subjects have been covered, including how to integrate or how to achieve behavior change in the area of health, how to attain universal health coverage, what role that plays. We've also looked at how it plays into the Sustainable Development Goals. And today we are discussing how to entrench the social behavior change. Now, with me on stage, I have a very eminent panel. To my right, we have the director of the U.S. Agency for International Development, Patrick Wilson. You're in charge of regional integration as well as support systems for the Kenya and East Africa mission. Do you want to say a hello to the people watching from home, from their places of work, as well as our audience? Just before you say that, actually, we have persons from 25 African countries represented. Do you want to say a quick hello? Hey! As you can see, we've been having a very good time. We're being taught a few chants as well as a few dance moves. We'll get to that a bit later. But Patrick, maybe you can say something?
Well, it's a great pleasure for me to be here representing the U.S. Agency for International Development, which is part of the U.S. government in our partnership with the people in the government of Kenya. Thank you very much.
All right, thank you very much, Patrick. And next to Patrick, we have somebody who's representing the government of Kenya. So we have the donor community represented. Now we have the government of Kenya represented. We have Dr. Sam Mahugu, who is in charge of the health promotion unit at the Ministry of Health. Maybe you can say something?
Africa hoye! Thank you very much, Ms. Barrows. It's a pleasure to be on this panel, and I look forward to engaging interactions and productive interactions.
Okay,
Thank you.
We're happy to have you. Next to him, looking lovely. Is that fuchsia? The color of your jacket? Yes. It is? Okay. That is Jane Mwangi. I think she addressed some of you in the morning. She is the executive director for the KCB Foundation. Maybe we can say another hello?
Yeah. Hello and good afternoon. Happy to be here.
All right. She did speak on the multi-sectoral approach to the SBC. And next to her is our host, and that is Joyce Wanderi Maina. She is the Chief Executive Officer of Population Services Kenya. They know you very well, but perhaps you could just say another quick hello.
Hi, everyone. We are glad that you're still here, and we hope you enjoy the session.
Okay. And next to her is Dr. Githinji Gitahi. He's the CEO Amref Health Africa. Karibu sana. You spoke yesterday, didn't you? Together on a panel with Sabina Chege. Okay, but I'm sure the audience is eager to hear much more from you. We did save the best for last, didn't we? Yes, and so you can say something?
Thanks. Yes, I was here with the Mheshimiwa Sabina Chege. Thank you for saying that. So it makes it sound important. I was with the parliamentarians here, for those of you who are missing yesterday. My name is Githinji Gitahi. I'm the Global CEO for Amref Health Africa, but I also act as the co-chair for UHC 2030 globally. So UHC is very close to my heart. Jambo. Jambo.
Right. And representing Safaricom, he's the Senior Manager Technology for Development. That is Benjamin Makai. Karibu sana.
Asante.
All right. I did introduce you a bit earlier. We started with you, but you can say another hello.
Yeah, hello. So my name is Benjamin Makai. I work for Safaricom in a very interesting department called Corporate Responsibility. I will be telling you more about what we do there. Thank you.
All right, Karibu sana. So you all know what social and behavior change is and what social and behavior change communication is about. But perhaps the people who are watching from home or the people from their places of work, on their phones, on their laptops, are not very clear on what that is. Joyce, could you perhaps break it down for us? What is social behavior change?
The way we look at social behavior change is really how we, as a way of trying to make sure that people live healthier lives. For example, I'm giving an example of health sector because that's where I come from. And we look at the factors that really make people do what they do. For example, whether it is barriers or motivators that are both personal, or they can actually be things that are surrounding them, that are interpersonal, or even societal issues that they are facing. So for us, We look at social behavior change beyond communication, because I know most people think social behavior change is communication, but it's really looking at the entire ecosystem of where the client is and trying to see what is it that we can do to really make them do the right thing that we want them to do. In this case, if, for example, you want them to sleep under a net, that's a good example for really reducing malaria prevalence. Or if you want them to use a condom for HIV prevalence. So we have to understand what is the opportunity for them to be able to do that, what's the motivation behind that, as well as the availability of what exactly we want them to access, whether it's a product or a service.
Okay, all right, thank you so much. I wish I could ask them, are they clear on that, if they have any follow-up questions. So we have the banking community, banking sector represented, we have the health sector represented, we also have the communication sector represented, stroke private sector, Safaricom represented. I'll start with you, Benjamin. How does SBC factor, or how is it factoring where Safaricom is concerned in your strategy?
Well, for us at Safaricom, we exist to transform lives, and basically for us to be able to transform lives, we have to connect people to knowledge, connect people to people, and also connect people to opportunities. So speaking based on where I sit, it's more of how we leverage on technology to ensure that we bring about behavior change, and it's mainly leveraging on the capabilities of a mobile phone to bring change, be it in health, education, or agriculture. And that's what we know how to do best as an organization.
All right. Okay. From a donor community perspective, how has it played into your model?
So I think behavior change is really at the heart of every development project. As we heard, it's really started in the health sector, and that's where many people are familiar with it from, is the health sector. But whether it's convincing men not to beat the women in their houses in terms of gender-based violence, whether it's in terms of convincing people not to ask for or give bribes, this is all about changing human behavior. And we can even see it in our own lives. So my mother spent her career as a nurse, and she was always telling me when I was a boy, she would say, "Patrick, wash your hands, wash your hands." And, okay, I did it because she was my mother, and I would get in trouble if I didn't. But later, as I grew up and I understood, she was telling me to do that because she didn't want me to get sick. And I think for the development practitioners, that's the most important thing about behavior change, is everyone's behavior is rational from their point of view. Whatever influences they have, whatever they're experiencing in their social life, their behavior is rational. So if we want to encourage people to change that behavior, we have to give them a reason to do so. And that's just basic human respect. So it's about communicating to people, not only telling them, but also listening to them, understanding what their perspective is, and then applying that to whatever our development goal is.
Okay. Is it a consideration, or is it something you take into account when you're considering what projects, for example, what development projects to get behind?
Absolutely. No development project can be imposed from the outside successfully. It has to have a root in the community. The people in that community need to accept it and take it on. That's the only way development can be successful. And so it's only in those areas where we know that we can successfully address that change in behavior that that's a project that we're going to get behind.
Okay. Jane, from you're the ED of the KCB Foundation, but you spoke about a multi-sectoral approach to SBC. How is it playing out in the private sector?
In very many ways, and let me stick to the program that we are running to Jiajiri, where we really work with the young people, trying to empower the young people, skill them for self-employment, and take them through the phases of first skilling them, giving them scholarship to go to vocational school. Behavior change comes in. At that moment, it's important for me to be able to convince them to wake up and go to the vocational school. First and foremost, even to have a positive attitude towards the vocational school, changing their mindset. Then in stage 2, where we go and help them start a business along the skill that they acquired, either start a business or even link them up to a job, a lot of behavior change. And as a matter of fact, as we've been implementing the program, so far we have about 23,000 beneficiaries. This year alone, we've done another 10,000, so about 33,000. It dawns on us that behavior change plays a very critical role. Actually, what undermines my investment is when the mindset is not changed. It doesn't matter how much I invest in the young person. It doesn't matter which college I take them to or how much money I give them as a loan. If they don't change their behavior, their attitude, their, even just their perception, their self-value, really, I can't go far. Therefore, when you look at that in the multi-sectoral setup, then you start realizing that financial institutions can't do whatever they want to do in the business world alone. You've got to combine business and development in order for you to maximize the result or to get an optimal result that you're looking for.
Yeah. Okay. All right, Dr. Sam Mahugu. The government has been accused of focusing more on especially in health, focusing so much on the curative side of things and neglecting preventive interventions, which is where SBC comes in. Is that a valued, sorry, not valid, but is that a fair assessment?
Let me start by saying that the government is a reflection of the people that put the government in place. So, what I'd like to say is that we are all in this together. And this is the reason why His Excellency the President undertook or saw it wise to begin the Universal Health Coverage initiative as part of his legacy. And the Universal Health Coverage, or Care, is really anchored on preventive and promotive health services rather than the traditional curative health services that the ordinary Mwananchi or Kenyans are used to. So for us, we are really focusing a lot on seeing how we can empower the communities at grassroots levels through the community health volunteers, together with the lower level facilities, and really seeing how we can have a bottom-up approach towards delivery of health services in Kenya.
Okay, so, do you have any case studies you can...
Yes, we actually are piloting the Universal Health Coverage program in the 4 pilot counties of Isiolo, Nyeri, Machakos, and Kisumu, and we're already seeing fruits or benefits from adopting this kind of model. But as we were saying even during this conference, behavior change communication is something that takes a while to really be able to be seen in terms of, or felt in terms of impact. So with time, for sure, we will be able to address the concerns that you are raising.
Okay. I don't know if that's specific enough for me, I'm sorry. Joyce gave the example of, for example, malaria. Yeah, you want to combat malaria, you need to encourage people, get people to change their behavior and start sleeping under nets, for instance, as one intervention. Are you backing any such program presently as government?
Okay. I'll give you the example of our routine immunization program. For a while, we've been really not faring well when it comes to routine immunization. And what we ventured out to do is really change our approach to improving uptake of routine immunization. And what we've done is that we've been able to work together with our community health volunteers in 17 really most vulnerable or the highest, most at-risk counties in Kenya, with partnership with Gavi. And we have come up with strategies that are really community-based and involve even a selection of champions that are recognized, respected by the communities, who are influencers and are actually able to influence change of behavior of the Mwananchi or the public, with a view to making sure that we create demand for them to actually voluntarily bring their kids who are under 5 or of the required age for the services. Okay.
Yeah. All right. You talked about community-based organizations, and I'd like to bring Dr. Gitahi in at that point. AMREF, I think, by comparison, is a fairly large organization. But how would you advise these implementing partners on the ground? because we've talked a lot about sustainability. How do they build their capacity in the area of social behavior change and strengthen their structures?
Thank you. I think for us, we have been working for about 6 years with the communities in Africa. We work in about 35 countries in Africa. And that's one of the things which has come to a realization is that the approaches, the traditional approaches of behavior change communication is based on the assumption that knowledge is a challenge, that the absence of knowledge or information is a challenge. Whereas, if you actually look and work with the community very deeply, you actually find out that though knowledge and information is necessary, there are other factors that result in poor health, for example. And those factors, you can classify them as structural violence and issues related to agency. That the fact that a woman came to the clinic at stage 4 cancer doesn't mean that the reason she came to the clinic at stage 4 cancer is because she didn't know or because she had no knowledge. The issues could be that gender inequality is the biggest reason why she came to the clinic at stage 4 cancer. It could be poverty, the fact that actually she didn't have the resources to come. It could be that her husband didn't allow her to do so. There was a small case that was, that was documented by Partners in Health in Uganda during the HIV era. And we were looking at using orphaned children to talk to other children to change behavior on HIV. And in one such setting, they asked young girls who they were using as mentors to others to list what they thought was the highest risk for HIV for the communities. And they were surprised because when the girls came back, they said, they expected, inappropriate sexual behavior, this and that. And they said, no, it's poverty. They say poverty is the biggest risk to us for HIV transmission. And when they were asked to explain, one girl made a very telling statement. She said, I am an orphan, school is not free. If a man wants to play sex with me and pay my school fees, I'll let him do it. So actually poverty was the biggest issue. They may know that you need condoms, you need to do proper behavior, but poverty is the biggest issue. So for us, I think for us to institutionalize social change or behavior change is not purely about communication. It's about actually institutionalizing the things that give people agency, the things that improve people's livelihoods. When you offer free primary education, that for me is massive social behavior change program. It's because it goes to giving people agency that now I can go to school, I don't have to depend on this man to pay my school fees. So I think for us, maybe to answer more specifically your question, is to say that sustainability for social behavior change has to start with the social determinants of health, where people live, how people live, and then as you sort out those things, the communication and knowledge environment should be embedded there, rather than a one-way or two-way kind of, I'm telling you what you need to do for you to change behavior. So that's our learning, and therefore we work with these organizations to go beyond just the communication to understand how people live.
Okay, there's a book by Malcolm Gladwell, and it's called The Tipping Point. I don't know whether you've read the book. Okay, so is there usually that one factor that if you address, or one of these influencing factors that if you address, you get a domino effect? And how do you go about identifying that particular issue?
I was really worried about you asking about the tipping point and what page and chapter, so thank you. So I can generalize because I've read the tipping point. So, but the tipping point that I see is if you alleviate poverty and you give people education, that for me creates behavior change. I don't think, when I look at some of us, and there are many of us here, I don't know how many of us actually started brushing our teeth because of communication. Many of us started brushing teeth because we were able to access, the fact that we could brush our teeth, Communication helped. When we went to school and there were these posters that said, oh, you brush 3 times a day, Colgate, it was fine. But even before I saw those things, I had already started brushing my teeth with a stick. Yeah? I hear Alfred saying stick. We would cut them on the way to school and we would basically do this. So the fact that the communication was there was just enhanced, but the ability to access. So for me, the tipping point, especially for our communities, for health, is education and poverty. So social programs that give free primary education, Universal health coverage that allows people to access care when they need it, where they need it, are for me the tipping point for behavior change. So we cannot blame people for poor health. And I think even when you look at our curriculums that we use in schools and training of nurses and doctors, we tend to approach it from a point of view that when somebody doesn't take care, it's because they don't know. No, it's because they can't access it. So we must train people to go beyond the facility, go to the community, and you do a holistic approach to care. Even when we take social history for patients, and many of us here who are doctors, when we ask people about their history, we ask them, do you smoke? Do you take alcohol? Have you been exposed to this and this? And we forget the whole story about how many people are you at home? When is the last time you had a meal? You know, before even we go to these things. So even extending social history that we take. So it's, for me, it's a poverty and education are probably the tipping points for behavior change.
Okay. Joyce, how long has this approach informed your strategy as PS Kenya? And there's a reason I asked that, but first, maybe you can tell us how long.
So, first of all, PS Kenya has been doing social behavior change for the last 28 years or so. And I think deliberately, you'll notice this conference is called Social Behavior Change and not Social Behavior Change Communication. Because just to add to what Dr. Gitahi said, I think the way we are looking at behavior change nowadays, it's not just communication as a solution, but there are many other things you have to look at that need to be addressed from that social, the S for social. And that some of the things cannot be just communication. And when you talk about tipping point, then you have to also try and understand the science behind the social behavior change and understanding what are really the intrinsic factors that are making people not do what they're supposed to do. And sometimes it's poverty, as he said, education, big things. Culture is very important in Africa, which we talked about in the last couple of days, which is very deep, and we need to look at it. Sometimes it's a barrier, but sometimes also an asset that we need to leverage as a continent to really make it work. So I think to your question, yes, we've been doing this for years, but the science evolves over time. A lot of work on social behavior change has to be evidence-based, so we do a lot of research, formative research. And just to add, like what Dr. Gitahi said as well, are really understanding what the community's issues are. So what we really look at it from a point of view of, we call it diagnosis, design, deliver. That's the model. We really have to really diagnose what are the issues. And sometimes they are very deep for you to be able to design what the approach is. And it can be anything. It can be an intervention that it has nothing to do with communication. Then we test it, we prototype, and then we deliver and measure. Measuring is also very important. So for me, I look at it as a combination of a science and an art. And even as much as it started in the health sector, it's something that needs to really cascade through all the other sectors, because we really try to fine-tune it over the years through lessons. Even through the last couple of days, a lot of things have come up on how we should be looking at this differently, and talking about multi-sector as well, and how we should be looking at it from a point of view of working with others.
Okay. And the reason I asked that, because PS Kenya also works in the area of HIV and AIDS, and we have these communication campaigns, and I know many of you, I don't want to say this because it's still early, but the many campaigns that you've run that are very memorable and they stick with you. You know, you hear young children even, okay, those who stay up late and singing along. I don't know, okay, I should not say this now, but you're saying it goes beyond that. It goes beyond just communication. So now, for example, last year, December, World AIDS Day, there was a campaign around getting more men to get tested for HIV and AIDS. How would SBC play out in that sort of scenario?
So a few things. One, communication has its role. It will always be there, because even if knowledge is not the issue, sometimes you have a whole new intervention that knowledge is actually needs to be addressed before you move to the next level. I'll give you an example of testing. There are new technologies coming up, for example, self-testing. We are now doing oral testing for HIV. That's a whole complete new thing that people don't know about. So you have to really start and address knowledge first, and then now go to the second level and start thinking what will stop people from actually getting tested. So for example, for HIV testing is a good example, because one of the biggest problems we have is men, and I know we have many men in this room who don't go out to get tested, and we really have to think differently. how do we start getting men to get tested? And this is where now other aspects of behavior change start coming in beyond communication. Because you have to start thinking about, is it an issue of, are they motivated enough to do it? Where do we get them? How do they access the commodity? Or rather the service? Do we need to get service out of the hospital, for example, and go out there and test them? For example, oral testing. And that's a good example, because I'll tell you, even with the work we've done so far, we found most people who are accessing oral testing are actually men aged 25 years and above, because they actually found a better, convenient way of accessing the commodity. So you can see there we've also addressed the issue of access, not just communication. So when you're thinking about a social behavior change, you have to think about the whole 360, that the commodity has to be there, you have to address the barriers, and you have to ensure you also address skills. So it's an issue of what we say in our world, opportunity, ability, and motivation.
Okay, Jane, the KCB Foundation. How has SBC informed your operations beyond, we've all heard of corporate social responsibility, CSR, but how has SBC come into play?
It's come into play in several layers. First layer, at the corporate level itself, where we have had a conversation with corporate and told corporate, if we do not start addressing societal issues as a corporate, sooner or later, you realize that comes to bite us as corporate. And I like giving the good example that I gave earlier today, that if 70% of the population is youth and 70% of them are jobless and hopeless in that, in that regard economically, you as a bank, 20 years down the road, frankly, you don't have a future. Or let me even reverse that and say, if with the profits you're making today, you're only making it from 30% of the population, or even less than that, can you imagine if you increase that, that particular category by intentionally going into the community to solve a problem so that you can create long-term profitability? And in there lies our concept of shared value. So when we looked at the work that the foundation was doing, and for the longest time it was so much philanthropy. Philanthropy is good, but philanthropy is relief. Okay, so corporate social responsibility is good, but it's just a responsibility. But when we shifted and we changed our behavior as corporate, influenced corporate to change their behavior, to do corporate social investment intentionally, choosing to solve a problem so that you can create durable solutions that result into profitability. Then in there you start looking at community differently. You start looking at society differently. You start looking at the challenges we have in the country differently. Every challenge presents an opportunity, and an opportunity that will create business value. Not necessarily, it shouldn't necessarily be addressed by government. I keep saying ideally, government should really play the enabling role, but it's in the interest of business to solve problems so that they can make money. But for them to solve problems, a lot of the societal problems, and from the experience now we have, even dealing with the young people, the problem is so enormous you can't do it alone. Development kicks in. Development becomes a precursor to business. And so, in order for you to do business well and maximize your profits, you must also change your behavior and realize that you can't go it alone. You must deal with partners. You must deal with development actors as well. And so in that regard, I would say that with the young people we are dealing with, we are happy that as we influence corporate, we influence government, we influence community, we start seeing results. But then the young person also must also be ready to change.
Okay. Yeah. All right. Now, quick question before I come to Patrick. How many of you come from the NGO CSO world? Okay. Now, that's a significant number, Patrick. As more countries get the middle income status, there's an expectation that development partners such as yourself will start to pull back a bit. How then do we get government to play a bigger role in terms of sponsoring and backing these people's work as they seek to achieve social behavior change?
So the purpose of every development program should be to end the need for that development program to exist. And that's very much at the heart of how USAID operates. We are working so that Kenya no longer needs assistance from the outside, that the Kenyan people can take care of the Kenyan people themselves. You mentioned government, and government has a very important role to play. That's not just the national government, but also now with devolution under the 2010 Constitution, it's about county governments. But it's not just government alone. I love this point about how government has a role in creating enabling conditions, creating an environment where a civil society organization, a Kenyan from a background where they want to make a difference, they can found an NGO, they can create an organization, and they can create the change that they know that they need in their community. It's about government creating an enabling environment for business. Businesses are profit motivated. They want to make money, but they can only make money if people are prosperous and doing well. So at USAID, we believe that if you can harness the private sector and that profit motivation, if you can find a way to show business that they can do well by doing good, that is your sustainability strategy, already built in. If a business knows that they can make money by making sure that people are developing well, that's a successful development program. And that enables organizations like USAID, as you say, to pull back, not to completely disengage. The U.S. and Kenya have a long relationship. USAID has been here for more than 55 years. We have stood with Kenya since independence. And we will continue to be partners to Kenya. But once Kenya no longer needs the sort of work that I do, we will be able to find new ways to partner with each other.
Okay. Dr. Mahugu, how are you preparing for that eventuality?
It's really more of how government is preparing for this eventuality rather than just Dr. Mahugu. But basically, as government, I'd like to say that really the risk that you run of heavily being dependent on the donors is that donor dependency, and that is something that no government would ever want to find itself in a situation of that sort. So for us, it's just like when you bring up a child in the home, you expect at some point the child will move out. So it's about time this 55-year-old child that has been ably supported by USAID amongst other partners is actually able now to sustain themselves and really has reached that stage of maturity where we can be able to really develop on our own. And I think one of the things that we would need to do, first of all, is to make sure that we prioritize some of those sectors that have been alluded to by Dr. Githinji, the social sectors, that are really critical if we're to have an empowered population that can be able to actually develop on its own. And in addition to just education, we're also talking about ensuring that we have good security arrangements within the country, and also making sure that the health sector is adequately funded and well-resourced. We are rolling out the competency-based curriculum, whose effect we'll see in very many years, a number of years from now. And the essence of this competency-based curriculum is that ability to be able to identify the talents that exist within our children and be able to develop them to the full potential. Now, being able to have that kind of approach and really ensuring that we pay the requisite attention to the social sector will result in a situation where, with time, we will end up being like more or less the developed countries that we work with.
Okay, Joyce, has Dr. Mahugu provided any sort of assurance? Is your heart beating slightly slower now?
Yes, I think he has, somewhat. I think it's a partnership that we have to walk the journey together. And I think for all of us is to realize that the time has come. If Kenya is really a middle-income country and other African countries as well, we have to have sustainability in mind from the beginning. So how we design programs from the beginning, we have to have sustainability in mind, not an afterthought. And I think also the other important thing in terms of partnership and working together is really building capacity of institutions to be able to deliver on, for example, behavior change long after donor funding has ended or declined. And there are many examples of that. I think Dr. Mahogu can tell you, we've worked with him with the Health Promotion Unit to try and make sure we are strengthening the stewardship of the government to oversee communication specifically and health communication specifically, so that when we are long gone, the art and the science still continues in the country. And of course, even working with other local, smaller entities on the ground to really empower them to be able to do this. I think in the past, we've looked at these local institutions or local workers as agents to do this, but we need to flip that and start upskilling them to be able to do this, and not just as an implementer, but people that can take over social behavior change after us.
Okay. Dr. Gitahi, do you think we've had enough conversations around this? Are there enough conversations around this?
I would hope that you're talking about whether there are enough conversations around sustainability,
yes,
from donorship to ownership, all these kinds of things. I think the conversations are happening. As whether the conversations are being listened to, that's a different conversation. And for the longest now, we've talked about domestic resource mobilization, because that's what basically we are talking about. We are talking about how do we hand over, as was said by a colleague here from USAID, how do we make ourselves irrelevant, even as CSOs, become irrelevant, so that now we become part of the community in implementation rather than funding agencies for donors. And I think we then have to rethink sustainability from purely being financial, but also being institutionalization. Because we tend to think about sustainability, as my colleague from KSB said about, is this financially sustainable? But I think institutionalization of policies and practices and behavior and social, all these things is sustainability. So we look at programs where, for example, in female genital mutilation, where we've worked for a long time, where getting the government to adopt new policies, put a law in place to say female genital mutilation is now against the law, that is sustainability, because you're actually creating policies for the future. The other thing I would like to say is the conversation around how do we make financing of our health programs sustainable, because I think that's where your question is coming from. Mahogu is working with the Minister of Health. There have been conversations around this where we say, number one, if you look at HIV, 80, 70%, I don't have the exact number, it doesn't matter, of our HIV programs and commodities are donor funded. Okay? If you look at immunization, I think Gavi provides, now we are starting to move towards reduction, but Gavi maybe is doing about 75% financing. If you look at family planning commodities, I think we are still at about 70% of our family planning commodities are funded through the GFF, the Global Financial Facility Initiative. The question is, the funding can continue to come, but how do we start to shift these items towards a health financing strategy in the country? And how do we start to shift these budgets to be integrated and start to have the government planning for family planning commodities? The source of money is relevant, but the government needs to plan and say, this is how we are going to finance them. And we've seen those things happening in some countries like Rwanda, where they say, even donor financing coming, but the plan is a government plan. So I think it's got to be a transition plan. It's not going to be fast, it's not going to be quick, it's a transition plan. Then the CSOs shift from being donor conduits, but become implementation partners for government. If you look at Global Fund, and I don't know how many CSOs here are working under Global Fund, the money comes in to the government through Treasury, but then after that, it is actually awarded to principal recipients and CBOs, but the government is overseeing the TB, malaria, and HIV implementation. So it's a conversation that's happening. I think the question is to shift purely from financial to also institutionalization and creating policy frameworks for the future.
Entrenching it, which is the theme of this particular conversation. Benjamin Mackay, Jane spoke to the role of the private sector, what role the private sector can take up and is taking up where social behavior change is concerned. Now, you work in the area of technology. Can you point us to a certain example and tell us, okay, so this is how Safaricom has already become a partner in this endeavor?
Sure, thank you. So ours is quite exciting because it's more of like how can we leverage on this technology to bring about behavior change. And as Jane alluded to, it's more about partnership, and we might not be able to do it on our own as an organization, and if we really want to embrace shared value model, it's more of like identifying those opportunities within the society, finding ways of solving those issues within the society, and the only way we can do it is through leveraging on the resources we have, the capabilities we have, and then working with partnership. I'll give you an example. Majority of us know that it's quite difficult to do revision in current setup. As in, kids have to go buy like past papers. A past paper could cost like 40 shillings, and once you use it, you don't have use of that particular paper again. How about digitizing this particular content and the kids can access it at the comfort of their phones? I know in schools, students are not allowed to have their phones, but majority of the students or kids are maybe day scholars, and their parents can allow them to use their phones to do some revision. It's in view of this that we partnered with an organization called ENESA to come up with a product called Shupavu 291. And Shupavu 291, kids are able to revise at the comfort of their homes. And actually, some of them who have used that particular tool, they've been able to get good scores and go to national schools. The other example is what I think one of our partners, before we broke for lunch, I think they did a presentation, CarePay. I mean, basically what happens when you are unwell, you always go to your friends, you go to Dr. Gitai or somebody else, you call for Arambes and everything. We know government is coming up with the insurance scheme and everything, but inculcating that culture of putting some resources aside for a rainy earth day is what CarePay is trying to do. And that's how they partnered with us as Safaricom to come up with a product called MTIBA, whereby you create a conditional wallet, you put some money aside, and you can only use or rather access those funds when you are in a health facility. So those are some of the examples, and for us it's more of like changing the narrative altogether from the core mobile technology, or rather what we are known for, SMS, calling and those kind of things, and going out there to our customers and looking at what is really pressing in the society, and then leveraging on technology to solve those issues. Ultimately, we'll be able to make some business case out of it, and it resonates with what the organization believes in, or rather what we believe in as Safaricom. It's more of like purpose first, then the people, and ultimately, if you solve that problem within the society, the willingness to pay and the ability to pay might crop in, and you'll be able to make some profit. Thank you.
Okay.
Allow me to add something, I think, on the sustainability question before we forget, because I think the role of government is critically important, that even as we deal with the donors, the government needs to continuously increase its allocation to the health sector, for example, to achieve the 15% budget declaration, to raise our contribution to the health as percentage of GDP to about 5%. Right now, our target is 15%. We are lucky to be at 7%. You know, we're still way ahead, way to go. And that's the other thing that we must remember, that even as we talk about sustainability, is about the tax systems, about compliance with tax, about utilization of the tax, accountability, and then allocation to the health sector so that we are self-reliant.
Okay. Benjamin, the proof they say is in the pudding. You mentioned Shupavu. Okay. Can you walk us through it? Is it something very complicated?
No, it's not complicated. You just dial *291#, and
all
then
right. Do you have your phone?
Yes.
All right. Oh, nowadays you can't go anywhere without it. You feel naked. *291#. 291#. Yeah. Okay. All right. All right. Has anybody gotten? Is it called an MMI message? What is it called? Has anybody gotten a message? All right. Microphone. Maybe somebody can tell us what's come on their phone screen. Can we have a microphone shared out? You can tell us what's on your screen? Okay, just 1 second. Let her hand you a microphone. Okay, what does it say?
Hello there. Welcome to Shupavu. Are you ready to improve your academic performance for 2 shillings of airtime daily? So you have 2 options. 1, register me. And number 2 is about Shupavu 291.
Okay.
So the first thing is to do registration. So the reason why
assuming you have the 2 shillings to spend on improving your academic performance. Yeah, okay. So, all right. So you said yes, next step, we pick one option.
So once you register, you are able to identify the specific courses you want to revise in, and then it's unlimited. Actually, you can revise as much as you want for 2 shillings within a day. I mean, by the end of it, you'll be able to gain value for as long as you're there. And at some point, you'll be able to have an option to interact with them. A live teacher, and that teacher will also be able to guide you.
Okay. Does anybody here with kids in school use this platform? Shupavu platform? And maybe they can testify as to the impact it's had, the social behavior change it's resulted in. Anybody with Shupavu? Or with any mobile application? Okay, all right. Well, maybe not this particular audience, but perhaps somebody else can tweet us and let us know and give us the experience with Shupavu. But Jane, now to you. Safaricom clearly is on board. How can we get, and KCB is on board, they understand, they appreciate the premise of social behavior change. How to get more corporates on board?
We will add more corporates on board when we who are already on board show the results and the value add and the impact both to society and to community. I mean, to community and to business. And the more we are able to showcase that, then the more that we start seeing very many other, corporates beginning to look at the corporate social investment as something that is desirable and something that makes business to them. You see, for as long as they're not able to see that, if there is no demonstration of the business value, because you see, remember, at the end of the day, for business, for corporate, it's about the return on investment. Okay, so you must draw that correlation between the social return on investment and the business return on investment. And if it makes business sense, believe you me, business will do it. How have we done it as a KCB? Both the bank and of course the foundation. I think as recent as December 6th, we were graduating our class of 2018. A whole 10,000 of them who had gone through the program. But besides just taking them, giving them scholarships and having them graduate, we were showcasing the businesses that they've been able to start, in the course of the year. And as they start that business, you realize that in their life sustainability to the work we were doing, because if it makes business sense to business, business will continue doing it, whether or not the foundation that is also in partnership with donors, does it or not. You get me? For as long as corporates are seeing that this makes sense, donors will come in, partner with foundations to catalyze the ideas. But those ideas must eventually become business products. And once they become business products, it becomes business as usual. And at that moment, if you are dealing with a bank, like, of course, that's a sector the bank will cut a business product, a commercial product that it will now sell. And I'll give you a good example of some of the things that we are doing. We are beginning to do things like container salons, fully kitted salon with everything and a brand, because we are beginning to franchise. As we start all these new ideas and we pilot and they're successful as a foundation, it will move in to business. And now business can cut a product, a loan that is tailored to that. And once that happens, it's time for me to exit. Pretty much what Patrick said, US said, that's the role of development. You catalyze, then you exit. It becomes business as usual, and that is sustainability. But as it becomes business as usual and business begins making money, you will have more and more corporates get into the space.
Okay. Yeah. Patrick, we all love success stories, and Jane has given us an example of one. What success story comes to mind when you think of social behavior change? Which development project have you gotten behind that has gotten tangible results that you can say, yes, we're happy with this, and this is as a result of this particular approach?
Well, some of the first examples that come to mind are in the arena of health, because that's really the first sector that grasped this idea of social and behavior change. So whether it's distributing bed nets to help prevent malaria and convincing people to use those bed nets every night, we can see a marked decrease in the prevalence of malaria across Kenya. Of course, in the area of HIV/AIDS, convincing people to get tested, those people who do test positive, that they know their status and they start on antiretrovirals, that they take those antiretrovirals on schedule and reduce their viral load. We don't have all the success that we want there, but clearly that sort of change cannot happen by imposition. USAID cannot impose it, the Ministry of Health cannot impose it. That has to come from individuals deciding, yes, I want to get tested. Now I know I'm HIV positive. Yes, I want to go on treatment, and I'm going to maintain that treatment. But I think we've also seen in other areas, for example, in education. So you were asking earlier about what is a tipping point. We believe very much that development is a data-driven enterprise. We don't believe in doing development by anecdote. We want to see data, and we want to analyze that data. Analysis of the data, programs that we've done around the world, shows that one of the biggest returns we get on our investment in development programs is by educating women and girls. When women are educated, the entire health of their household improves. The children also go to school, they eat well, they take their medicine. So educating women and making sure that women can get that education is a huge driver of almost every other factor in development. So, one of the social behavior change models that we're trying to implement across the world, from Kenya to Afghanistan to Colombia, is making sure that girls and women have the opportunity to get an education. And where we've done that, we've seen increases in development outcomes, no matter what the sector is.
Okay. So there's this Kenyan proverb, serikali tusaidie. So Dr. Gitahi, how do we turn it around on its head such that this change comes from, it's a bottom-up approach? How do we get community organizations to get more active and say, you know, the change is going to come from the grassroots, as opposed as looking up to government and waiting for government now to hand in, or to come in and solve our problems locally?
Well, I think the most important thing to change that mentality is to empower the people. Most of the people see government as somebody who brings money from somewhere to come and help them. What they forget is actually these are their taxes. Everybody pays taxes. Everybody, whether you're employed or not. There's nobody here who doesn't pay. Even somebody in a rural area, a woman in a rural area, or a man or a girl, pays VAT. Then we then empower the government, which we put in power, and say, here is our money. Please use it to improve our lives. So when we then go back and say serikali's idea, it's at least empowering, effect. It's like we are not aware that actually the government is us. So civil society organizations need to shift from helping to empowering. We need to shift from helping people to empowering them. And empowering people, you cannot empower people by delivering to them things and saying, here, please use this is a new toilet. You have to empower them to make the toilet, and your work is to enable them, to support them, to create structures in the community that make them take over these things. Because then they start to understand this is ours. We keep saying that in healthcare, there's no free healthcare. Even when you have free maternity, there is nothing like free maternity care. There's nothing like free vaccination. It is vaccination that is tax-funded. There is maternity programs that are tax-funded. So even when we change, we need to do behavioral change ourselves and say, first, can we change the language? Because the people must understand that everything we do is owned by them, so that then we can start to create citizens from nationals. There's a difference between citizens and nationals. Nationals are people who just sit and say serikali's idea. Citizens are that young man who went to Kenyatta, picked his baby and walked out with the baby because he didn't want to pay the 6,000. Because ideally, a child who is under 5 should not be charged. These children are not supposed to have a bill, and he wants his child home, and the government owes him health as a human right. So that's a citizen to me. But the people who say serikali's idea are nationals of Kenya. Now we have to ask ourselves here whether we are nationals or citizens. So how do we convert the communities to citizens from nationals, so that instead of saying Serikali's idea, when they go to a hospital and they find there is no care, they don't walk home. They don't walk back home and say, oh, hakuna madawa. They sit there and they call the facility committee and they call the facility in charge and say, how can I not get care here? This is really what we need to do. And if we work together and we convert the people to citizens, then this Serikali's idea thing will end. And for Patrick, Serikali's idea means government, please help me. I'm doing the translation service here for Olivia.
Did you know there's a difference between citizens and nationals? Which are you? All right. My last question to the panel before we take a few questions, 2 or 3. Joyce, to you. You're open, what's the word? You're awake to the reality that Kenya, I think, is already middle income status, if I'm not mistaken. But how have you readied yourself for the eventual withdrawal? Not really, okay, you said not withdrawal, but pulling back? Can I say pull back?
I'd say it's a transformation of our relationship from kind of a transactional, we give you money, you do good things, to a strategic partnership where we're continuing to work together to the mutual benefit of both Kenya and the United States.
So have you readied as PS Kenya and even just as the CSO and NGO world in general for that transition?
I think I did mention a few things, but just to revisit this, I think the first thing is around having sustainability in mind from the beginning. And when we talk about sustainability from our world, is about sustained health outcomes. So it's not about the money, but how do you sustain those health outcomes that you've already gained and keep the momentum, so you don't actually go backwards. And a few examples were given about Kenya's successes, which is also happened in other countries like HIV and malaria and contraceptive use in Kenya, which is great work that has gone where development money has catalyzed that achievement. So that's important for us to start looking at the sustainability in mind. And when we look at that, a few examples is really working with existing infrastructure on the ground. How do you strengthen community structures, for example, to be able to take up some of this work that we do? You are really shifting your role. Instead of being the implementer, you become the technical partner. So you empower them and upskill them to be able to do that. How do we also look at local innovations, local solutions, and promoting them? Because I think we've also noticed increasingly you start finding that issues are more localized. You can't have one size fits all. So how do you, for example, get to Turkana, understand what's going on, and really come up with local solutions and strengthen them for the communities to take them up? Again, on matters to do with the public-private partnership, very important. We talked about multi-sector. On this panel and even earlier yesterday, we talked about how to really look at the poverty, education, and health on one axis. Because when we talk to our clients, really, it's not just one issue they have that, like for example, health. So we have to deal with all the other issues. And we can't do that without thinking about public-private partnerships. And I think the shared value examples that are being given are really also helping us to see how we can now start transitioning our approach to aid and development, because then we have to also start thinking about working with corporates who have shared value in mind, and how do we partner to make sure that the communities we serve we are addressing their issues holistically. And I think we can't underscore the role of government, of course, and as you said, government is us, to really work in partnership to ensure there is domestic resource mobilization, that money, that finances that government is putting in place, not just thinking about curative, for example, in health sector specifically, we're also thinking about prevention, and that's where social behavior change comes in. So working with the institutions of government as well to strengthen their capacity to be able to oversee all the work that the civil society is doing. So I think it's not a hard task, it's already started. We've already started thinking like that as civil society. And we know, as Patrick said, right, it's really a strategic partnership, not the death of the NGOs really. It's really, and civil society and other implementing partners, our role is transforming. And we become more technical partners and strengthening, empowering others to do what we do better, as opposed to really being the implementers on the ground in all these things that we are doing in the various sectors.
Okay. We'll take 2 questions, I think, from the audience in the interest of time, so that you have time to deliver your communique. I see a hand right there. We'll start with that gentleman I think he was first to put up his hand. And then the second one, of course, in the interest of gender equality, has to come from a lady. oh, sorry, you had a microphone.
My name is Henry Chonero. I'm a development communicator from Daystar University. I want to ask a question, a serious concern about this idea of aid and donor funding. You know, it amazes me, or it irritates me as a Pan-Africanist, that Africa is the richest natural resource continent, yet it is the poorest continent on earth. And aid has been here in Kenya for the last 55 years. And I've never seen any country in Africa that has ever developed or has bettered the lives of its citizens through aid. Because what we don't understand, we are talking about social behavior change. For what? For the betterment and improvement of people's life. And the betterment and improvement of people's life is what is called development. And development liberates people from the chains of dependency. But AIDS creates dependency. AIDS does not make people to have responsibility. They don't own it up. And don't you think the whole issue of aid, because if whoever feeds you controls you, and you can never say you are developed unless you do it yourself.
Okay, so the question,
don't you think that this issue of donor funding and aid syndrome monster need to be done away with for Africa to realize her potential? Because development cannot be development unless it is done by Africans, for Africans, of Africans.
All right, thank you.
Thank you very much. My name is John. I work with Geopol. I'm the regional director, East Africa. My question is to the government. It's not serikali saidia appeal, but more serikali wajibika. My question is, we've been here for 3 days and you've seen very incredible initiatives that are being done across Kenya, for instance. What is the government doing to harness all these initiatives, to put them together, to create efficiencies, to reduce duplicacy of some of the initiatives that are being done? What is the government doing in making these initiatives, available to the people? I mean, increasing awareness around these initiatives, so that at least we have, one forum that people can get to learn about these initiatives, and even different players that are working within these different sectors can learn from each other and avoid cases, for instance, where we have duplication, like what we have in the health insurance, for instance, in Kenya.
Okay, thank you very much. A lady, please, and that will be the last question. Oh, come on. All right. Wow, all men. Okay, let's just take one question from the gentleman at the very end. Oh, have I represented our agenda? Okay. Okay, maybe we can start taking, getting answers to those questions. Oh, is it working now?
Hello?
Okay.
Probably this will be, Dr. Gitai probably could help on this. We're quite often talk about health investment financing in terms of RBF, resource-based financing, innovative financing, and we read about most of these in news and on websites. Could you kindly, from a CSO perspective, Dr. Gitai, paint a picture on how we are faring as Africa? I've had an opportunity to work with a fund management organization in Rwanda. That's we're managing funds for CODAID, Netherlands. But it surprises you how it works when private sector is involved, and when you give money to government, for some reason, things don't go as you expected. So how are we faring as CSOs in the health investment sector? And then to Dr. Jane Wanji, the banker, how have we helped the private sector in developing bankable proposals, probably, while we look at tapping into the opportunities available for health investment financing? I'm Ksima Alfred. I'm from Uganda. Thank you.
All right. You said Alfred?
Yeah, Alfred.
Okay, and you directed the question to Dr. Gitahi, I believe. All right. So we'll start with Henry's question, and Patrick will take that. There's a young man from, you said Daystar? Yat, who said he was irritated by this whole idea of Africa being rich in resources and yet relying so much on donor funding. What's your response to Henry?
I think you're right to be irritated, Henry. I mean, USAID has no interest in making Kenya dependent on aid. Quite the opposite. We truly believe that by investing in the journey to self-reliance for Kenya, that's good for the United States. I mean, that's why the United States, the American people, invest $400 million a year in Kenya. And I say invest, but that's a gift. Okay, it's a gift from the American taxpayer to the people of Kenya. It's not a loan. We never ask you to pay anything back. It's a gift. But I call it an investment. I don't call it assistance. I don't like calling it aid. And the reason I call it an investment is that the United States believes that when other countries are more free, more prosperous, when they respect human rights, when they have a thriving democracy, that's good for the United States. We want a world where more countries are free and prosperous and strong, independent and democratic. And that's why we invest this money here.
All right. Henry, are you satisfied with that answer? You can just give a thumbs up if you are. Here? You're here? Okay.
Henry, I'll say one other thing, is that if, as you say, Africa is one of the most resource-rich continents on the earth. Kenya itself has tremendous resources, not just in the ground, but in its people. So if those resources aren't being used well enough, then you're right. Kenyans need to look to themselves. They need to look to their national government. They need to look to their county government. They need to look to their churches and their CSOs, their communities, and say, what can we do to make better use of these resources for ourselves? And I promise you, the U.S. government will support you in that.
Okay. Henry, are you closer to, is it moving up or it's up? Maybe you can engage Patrick a little later, all right? Now, Dr. Mahugu, yes. Fortunately or unfortunately, you represent Serikali. And there was a question about Serikali Waji? Was it Wajibika?
Wajibika.
Yes. Yeah. James, was it? From Geopol? John from Geopol.
Yes. Okay. So what I'd like to say is, first of all, the role of government is to take a stewardship or a leadership role in terms of coordinating all the efforts that go into ensuring that all our health activities become a success. There is no point at any time Patrick would come to our meetings or to our organization and direct us on what to do. It is for us to set the agenda, invite other partners, and those who are willing, we will work together with them. If your agenda or your priorities are really not aligned to ours, really it becomes very difficult to work with you, and most of the times you'll find us really being hesitant to partner with such organizations. Now, secondly, the other thing is that it's very important for us to realize that as a government, we are representatives of the people. And much as there's this shrink in the donor environment in terms of resource allocation or resource availability, financial resources available, it also gives us an opportunity. They say in the midst of every adversity, there is an opportunity. So in this situation, we have an opportunity to actually come up with homegrown solutions. If you have a situation where we are over a period of time or in the long term relying on Patrick, for example, and USAID, to support our health activities or education or agricultural activities or whatever, it becomes very difficult for him or to be able to convince him that in Turkana, this is what would work. If you go to the coast region, this is what would work. But now we have an opportunity to actually partner together with our private sector players, NGOs, with a view to actually ensuring that whatever solutions we come up with are actually homegrown solutions. You can imagine yourself living wherever you're living, going to live or visit someone who is living in Turkana and trying to tell them how they should go about their business. It can't work. It is easier if you sit down, you immerse yourself in the kind of context that you find yourself in and see how you can come up with your own solutions that are really tailor-made towards long-term success and having a sense of ownership amongst those the people that you're actually targeting with your initiatives. Secondly is that we've talked a lot about 70-75% of our population being the youth or being under the age of 35. This is sometimes something that we give token mention to or we take for granted, just like sometimes you find behavior change is sometimes really taken for granted when it comes to rolling out of programs. Now, the youth are critical, and it is very, very important that whenever we are making making decisions on behalf of Kenya as government, that we involve them. And for us, it is critical that we involve the voice of the youth, not just in talk, but actually have them around the table where the decisions are made. So it's very critical for us to ensure that we bring everybody on board in terms of bringing the youth, private sector, and any other stakeholder that is relevant towards ensuring that we successfully run our development initiative for health.
Okay, before I get to Dr. Gitahi, John, has Dr. Mahuku amewajibika au la? Just wait for the microphone, please. Yeah.
We have very many great initiatives. I mean, the last 2 days here, we've seen a lot of initiatives. I'll give you an example. KCB is doing something about the youth. Safaricom is something about the youth. Why can't the government put those initiatives in one place and tell the youth, you know what, engage Safaricom on this? We've seen this, for instance, from USAID in Turkana. We have other SBOs that are doing stuff in Turkana. Why can't we bring all this together, like the way we did on PDU delivery in one website? Just tell guys, if you need to understand something about Turkana, go to this website and get information about that. It could be something around, for instance, health. We are seeing every county is coming up with their own health insurance. The government is doing its own. NHIF is doing its own. Why can't we pull all these resources, avoid duplication, improve efficiencies around some of these things and initiatives that we have? We already have the solution. What I'm asking is, why can't we put all those things together to improve efficiencies around them?
Okay, maybe the simple answer to that is that when it comes to behavior change...
Very briefly, if you could.
Yes.
Okay. No.
Yeah, very briefly. Yeah. Really, the simple answer to this is that we are not... in behavior change, there is something we call audience segmentation. Different members of Kenyan society have to be communicated or have to be communicated differently, if you like. It's not possible, for example, to communicate to someone in Turkana or tell them about some website that we've come up with that will really be able to address all their issues. How you communicate or how you do behavior change in Turkana is very different from how you approach it from the urban perspective that you are mainly talking about.
Okay. Dr. Gitahi, very quickly so that Joyce will have an opportunity to deliver her communique. The question from the gentleman from Uganda.
Yeah, okay. The question you're asking is about resource-based financing. Resource-based financing. I think the challenge we have with resource-based financing is the way it was approached as if, that suppliers of services need to be incentivized to provide those services. I think that for me is the wrong premise, because if you say that the more patients you see, the more money I give you, then you then end up with a problem of supply-induced demand, that where people call people for services just because they're going to get more and more of it. I think that the real game changer, what you call the tipping point in healthcare, is to shift away from demand side kind of incentives, from supply side incentives to demand side incentives. How do we shift financing from supply side to demand side, where the mother who needs care is the one with a card, who then decides which place to go, and the incentive of that place is that actually she's going to pay you. And therefore, if you have poor service, then the mother votes with her feet and moves from you and moves to another place. So I think the demand-driven resource-based financing is the challenge. So we are not doing very well on that, and we have to shift. And the drive towards universal health coverage is to shift the choice and the incentive and the power to the demand side and move it away from supply side. So that's really what my response. So the answer to you is that, are we doing well on resource-based financing? No, we are not.
All right, thank you very much, Dr. Gitahi, for keeping it brief. Don't they deserve a hand clap? They've been amazing. So have you. You've been absolutely amazing. So Joyce, I'd like to invite you to deliver your communique. Would you like to stand, or would you like to sit? It's up to you. Okay.
All right. Thank you, everyone. Please allow me to read what we put together very briefly, because I think it will help us be able to capture the richness of the discussions we've had for the last 3 days. So it's been very intense, of course, and extremely interesting for all of us. And we are very happy that you all managed to come and actually stay for the 3 days. And we are happy at this point to really be able to conclude this conference together. So as PS Kenya, we are deeply honored that this high-level conference brought together over 600 delegates, 31 speakers. We also had 146 oral presentations with representation from 25 countries, not to mention all the posters that were going around during break time. We are happy that it was an opportunity to share experiences and best practices, and people brought in their expertise from various sectors. Our vision for this conference as PS Kenya has become a reality. We've converged a diverse audience, expert panels with lively contributions on how to bring people working on the African continent together to look inward, reflect on African uniqueness, and see how we can further catalyze development in Africa through social behavior change. I think we've had various conversations around culture that were very important, and we did say that is also an asset and that we should be looking at to leverage on as a continent. A key takeout from the conference is that Africa needs to tell its own story in its own way. I think you heard Patrick Wako this morning talk about that. That was very interesting. I believe we shall leave here with lessons that we can adopt in our different settings that will be able to tell our unique African story. The solutions of Africa challenges and problems will come from us. Locally generated finance solutions have the best chance to truly bring about long-lasting transformational change to the continent of Africa and meaningfully contribute to the overall practice of social behavior change. In this conference, we had several sectors represented. I think you've also seen on this panel, from financial institutions, mobile technology, education, agriculture. We also had academia represented, civil society development partners. And this really does underscore the need for us to have a multi-sectoral approach to development through public-private partnerships. And I think we've had several discussions around that, and great examples from KCB, Safaricom, PNG, among others. Fellow delegates, we need to continue building on multi-sectoral approach, bringing in the players, including beneficiaries, corporate sector, and governments around the table to talk about solutions for various challenges and opportunities that we can build on. I believe that in the coming years, a couple of young people sitting here who will be driving policies and decisions then will remember the discussions we've had today. There was agreement that universal health care will bring a fairer deal to the African continent if only our countries focus less on infrastructure as a major hurdle, but also started looking at putting more emphasis on communities and factors that stop them from accessing health care. Speaker after speaker, they re-emphasize on the need for social behavior change, community of practice, to embrace a bottom-up approach, which has also been mentioned today. Solutions must be designed with the intended end user in mind, not just in the boardrooms. We talked a lot about human-centered, user-centered design. Communities have solutions to issues affecting them. What we really need to do is to drive meaningful change by working with them to package the solutions and support the execution. And this is really about a discussion about sustainability that we were just talking about just now. Time and again, accountability was emphasized. I think Dr. Gitai also did mention that yesterday, that the beginning of accountability is the people. We need to be in the forefront in empowering our people so that they can hold those in power accountable, and remember that the national resources should work for us as well as citizens. Citizens, not nationals. Allow me to quickly take stock of a few key takeouts to help keep conversation going beyond this conference. We don't want the conversation to end here. We want to continue having this conversation for the next couple of years, and even in other follow-on summits that continue even for behavior change and for development. Social behavior change has driven exceptional change in the health sector. We said it started there, and in many ways has been perceived as a preserve of the development sector. The challenge now is how social behavior change community of practice can transfer skills to other sectors to help drive meaningful change across diverse issues affecting Africa. We talked about poverty, education, and health being looked at together. Is not just about health. So we need to really make sure these skills are also being transferred to other sectors. There's a tendency to see behavior change from just a beneficiary point of view. We must broaden the horizon to include the entire ecosystem to allow gains of social behavior change to be truly felt. Social behavior change must include key stakeholders such as government, donors, private sector, policy makers. We talked about that yesterday, and somebody said, maybe the client is already tired of changing behavior. We need other people to change behavior. Marginalized and special groups do not need meaningless involvement in SBC intervention. It's an opportunity for us as a practice to look at what we mean by human-centered design. Truly make sure it's what we are working on. Putting beneficiaries at the center of designing interventions, or are they only at the center of implementation? Do we really appreciate the difference? We have to make sure that we are really user-centered. We need to continue building on social network analysis to understand the influencers better. And also, Africa is landed unique globally by two movements. We are seeing the fastest uptake of modern digital communication technology on one hand. On the other hand, we are seeing Africa has deep-rooted cultural practices and norms, which we've talked about in the last 3 days. We need to better understand this fascinating nexus between traditional cultural practices and values and modern digital technology, and better use both to inspire lasting transformation change. Where is where do the two meet, the culture and technology? Of course, we talked about data remaining king. We need to continue investing in getting better at using data for decision making by continuously understanding our audiences better, being able to evaluate and assess what we do, triangulating data to inform implementation, and of course, course correction. So that as we continue doing our work, we're also changing strategies, not just staying with the strategies that we started on at the beginning. We talked about SDGs on day one, and we said they touch on everyone. It's something we demystified. This SDGs is not just something that the government has to do. It touches on everything we do. We recognize that real and lasting change is achieved when people define and drive development themselves. From Kajiado County, remember, we had a very good example of how they are donating goods to pay for NHIF, and really just shows how much we can do with the assets we have to drive change. And we need to look within in different cultures and see what is that asset we have that we can be able to use it to drive change. The conference has confirmed that we have what it takes as a continent to bring about lasting change across sectors, however, unless as a continent we are informed, engaged, and at the forefront of developing solutions to our problems, we will fall short of making Africa the great continent it is. As we end, how we change ourselves as organizations and people already in the SBC practice to deliver the change we want better and faster will become very important. In conclusion, all we've discussed here cannot be fully achieved without the support of the media. I think today is a good example of how taking the conversation out of the room and getting others to have this conversation outside. Like today is definitely one of those opportunities where we get more Kenyans and other people from other African countries to be able to continue this conversation. It's time to work in tandem with the media to help them understand the change we are trying to achieve and their role in supporting us to drive meaningful change. And now a word of thank you to all that made this conference a reality. I would like first to start with the excellent moderators in the various panels. You led interactive and thought-provocative discussions across the 3 days that ensured that we responded honestly to issues that we feel passionate about. To our panelists, of course, who've given their time for the last 3 days and willingly, we really do thank you. The scientific committee that really helped us put together all those oral presentations and posters, we really thank you for the over 500 abstracts that were submitted, and you had to go through each one of them and ensure that we have a quality product in this conference. I would like also to thank you, the ASBC Secretariat, for the meticulous planning. You must agree with me that the conference was well planned. You didn't have to queue for long to do registration, and you had some good food, I believe. So we really thank them for making sure that we had an amazing 3 days of the conference. To our distinguished delegates, of course we cannot forget you, because this would not have happened without you. Your participation was very enriching, and your being present here for all the 3 days, all the breakout sessions, it's been amazing, and we really thank you for your honest and candid feedback on everything that you were presenting or the discussion that we are having in here and also outside. And finally, I want to offer my gratitude to our key partners who've also made this possible. Nation Media Group, thank you very much. USID, PNG, Safaricom, KCB Group, PSI, WPP, Mediacom, Clean Cooking Alliance, and of course all other partners. I can't be able to mention all of them. We really value your partnership. You shared with us on this vision from day one, and you've made us proud, and you've made us be able to execute it successfully. thank you very much, and we are proud to be your host for this conference, and we hope that it was really an enriching experience.
Has she represented your views well? What we want to know from you, Joyce, as we sign out is, when is ASBC Conference 2?
So we definitely are going to have another chapter in 2021. Look out for where it will be.
All right, thank you very much. You guys have been wonderful, so have you. Now, unfortunately, it's time to say goodbye to our audience on the other side of these cameras. It's been absolutely wonderful to have you on board. The conversation continues. The hashtag is ASBC Conference 2019. Enjoy the rest of your viewing.